Hi, everyone. Welcome. I'm Dr. Katie Woodley. We're going to give people a minute to jump in, probably joining us from their lunchtime. I'm also going to share this to our Facebook page, The Natural Pet Doctor, as we give people a minute. So let me do that. I'd love for you to drop in the chat box where you are joining us live from. So just comment your name and where you're joining. We love to see where everyone is in the world. Let me do this and then we will share this. So give me a minute. I see you all. This is awesome. We've got a good group of pet parents here today. All right. Let me get this shared. And then that way, also, if you're on Facebook, make sure you check out thenaturalpetdoctor.com. There's some links in there that will help guide you for some of the amazing information that we are going to be talking about today with the amazing Dr. Betsy Redmond that is joining me today. Okay, let me push that and make sure we are there. Perfect. All right. Awesome. Okay, we are all set. So I see people popping in. Is that chat box? Let me see if the chat box is working. If not, don't worry. We have a Q&A. Yes, awesome. The Q&A, awesome. Liz, I see you from Niagara and Canada. The chat box is not working. Don't worry. We're going to be doing a short Q&A session at the end because I know some questions are going to come up with the testing and what we're going to be talking about with gut health today. So I know people probably joining from lunchtime. So what I'm going to do is I'm going to introduce my amazing guest today, Dr. Betsy Redmond. A lot of you may not know her, but after this, you're going to want to know her and you're going to want to know the company Innovative Pet Laboratory because they're doing some amazing work to help improve and better pet guts and also their overall health and improve longevity. So Dr. Redmond, thank you so much for joining us. Dr. Redmond has worked in a clinical laboratory education and research for the last 20 years. She currently runs Nutrition Provisions, a private practice that focuses on individualizing science research and is a senior medical educator and researcher for a functional medical laboratory. She holds degrees in nutrition and environmental science from Texas Christian University, a master's of medical science from Emory University, and earned a PhD in nutrition from the University of Georgia. Much of her work has focused on gut health and applying metabolomics, I just butchered that, the study of metabolites in practice and the differences across species. Also residing in Atlanta, Dr. Redmond enjoys spending time with her husband, 3 kids, and 2 dogs, Ollie and Linda, who I've heard a lot about Linda.
Yeah.
Quite the personality. She also enjoys running and can never get enough of researching. It's her passion. And this is why I am so excited to talk with you, Dr. Betsy, today and hear all about what you've been doing, some of the exciting tests that have come out, and how the incredible pet parents who are joining us today can actually use these tests to help their pets. So thank you so much.
Oh, thanks for having me. Yeah. Yes, Linda's in the room, so hopefully she's looking around. Very old.
We'll hear some of the crazy antics from Linda today. So if that's the case, it's okay. We're all pet parents. We understand. It's entertaining.
Yeah, okay.
Right? Perfect. So first off, gut health is such a big topic and it's a newer area of research. And when I say newer, there is a lot of education and research on the human side, and we're kind of becoming more aware of it on the pet side. And so can you start off, Dr. Betsy, with briefly discussing the anatomy, some of the physiology of the gut, kind of the gut lining, the immune system, kind of at that higher level to help us get started and how it's impacting our pet's gut health?
Yeah, I mean, and I would say that there has been more, there's been pet research, but it wasn't directed. It was like human research, and they start, with animals, and then they go at rats, and then they move up. So when we started looking at this, hey, can we do our pets? Can we put our dogs in there? They're having problems. We looked back at the research, and it's they have quite a bit. And then some of it, they do have a lot of research on. So,
Yeah.
We want to see the big things we're looking at, with gut health is there any inflammation? is there, the gut lining, how we can see, can we look inside and see a gut lining and see if that's all tightly and put back together? Is digestion and absorption going well? I mean, I think everybody's probably heard the statistics. I mean, I just hear it all the time that, 70% of the immune system is in the gut. There's just so much activity, and it makes sense because the gut's really kind of outside your body. It hasn't entered. It's like within the gut lumen, it's still outside. So your system is pretty protective over it. So I think that the two biggest areas we look at are like inflammation and immunity.
Yeah. And in terms of, so how would we know if a pet has like an inflamed gut, or if like the immunity is not optimized with, something going on? Because I find this a lot of times, especially working with clients and patients, is, for example, we see a lot of allergies, and we treat the symptom of itchiness or the skin infection, but a lot of times we forget that it may have actually originated with an inflamed gut or an immune system issue that's a problem in the gut itself. So can you talk a little bit more about that?
Yeah, so for inflammation and immunity, the two markers that we thought were important is calprotectant and secretory IgA. So, I see your cat.
Yeah, we got one blending into the black rug behind me.
The little eyes.
The little eyes, yes, they're glowing.
So calprotectant, it's got, it's got a lot of good science in people and pets. But it's specifically, it's a granulin family. It's like metabolomics, not every. They're a family of proteins that's associated with acute and chronic inflammation. So specifically, we're looking at calprotectant, it's a S100 A8A9 protein, because you'll see sometimes there's like A12s or different things, but calprotectant is looking at inflammation. So it's looking at, cell proliferation. It looks at like turnover. It's really a marker of like danger, something's happening. So when I think of it as it's identifying neutrophil infiltration into the gut lining. So neutrophils are white blood cells within that family, and then just within the gut lining. So it's reacting to something that's happening. And so it's directly related to inflammation.
Yeah. And I think too, just to touch on that briefly for other people, is, those white blood cells are like the things that are fighting infection, but also come, as you're saying, the inflammation. So keep that in mind. The neutrophils are just one set of the white blood cells. And the other thing I wanted to clarify too, Dr. Betsy, is it with the calprotectin, is it identifying more like acute inflammation or chronic inflammation, or is it doing both? So like if our pets say, like, for example, like you cut yourself, right? We have acute inflammation, we mount an immune response, the white blood cells come and they fix it all up. Hopefully we don't get an infection and we resolve it. We don't go into a chronic inflammatory state. But with the gut, we can have acute and chronic, correct? And so what's, in terms of using calprotectin for those situations, what would be the best situation, or like the half-life of it? Or is that something that there's more research being done on that?
Yeah, I mean, it doesn't have like a half-life, I think like IgG has a half-life that I can like 3 weeks. And, but calprotectant does look at chronic and acute. So it's got a lot of benefits for why you would look at it. It has other properties besides just identifying it. It has bacteriostatic, it has fungistatic, so it can kind of decrease the ability of bacteria or fungus to keep growing. It does that by binding manganese and zinc. So there's always stuff going on. It's resistant to enzyme degradation. So that's, so it'll be consistent. It's easy to use in the stool. When you're looking at the gut, in both dogs and people, fecal is a better marker than in the blood, because you can look at it in the blood. So it's very specific to inflammation going on in the gut. And in research, it's been related to histology. So they've had studies where they've gone in and looked at the actual cells and within the gut, and they've related that. They've also calprotectant levels, and then they've correlated it to clinical severity. So it has a lot of, benefits as to why it's used. So I think of it as, you can use it to identify your level of inflammation.
Yeah.
You can use it to identify if things aren't getting treated. Like if you have a dog who is really sick and then you test a scalp protectant or hers, and then you follow up and you do the things to get them better, they get better, and then I'm all done. But calprotectin can let you see, is there still a low grade inflammation going on that you just don't know about? And even in research, they have those kind of concerns. Like you want to make sure that you're looking to see, has it really resolved?
Yeah,
So
I love that, because I have so many patients where, they come to me because it's like they thought things were fixed, and then they have another flare up of like GI symptoms. All of a sudden they were fine symptomatically. And this is potentially where this test would be really helpful. Did the treatment work, or are we still having that low grade chronic inflammation brewing in the gut? And it's not high enough where we're necessarily seeing like, blowout diarrhea, GI upset, or, all the GI signs that we tend to think of when there is a flare up. So I love that we now have a test to be able to see better how the treatment we're using is actually working.
Yeah, I mean, it's the same in people. So once people have IBD, like in people, and it's one of its claims to fame is that it can differentiate IBS from IBD. So if it's at a certain low level, you probably don't have IBD. It's not one single marker one time that's going to really tell you that, but it does let you see. And I think that what I'm seeing in the research for dogs, and there's some in cats, is that they're looking at it, more conventional vet clinicians are looking at it as, do I start this super high treatment? Do I go right in for steroid, immunosuppressants, or do I try to do it with food? So that's some of the research is looking at that dogs that are food responsive, that's going to be one level. So, or antibiotic responsive, that all you're going to have to do is change their diet or give them antibiotics. But dogs that responded, and this is like looking back at some of the research, that are steroid or immunosuppressive responsive are going to have a much higher level, and the non-responsive dogs are higher. So a lot of that research is looking at how to triage what you do. But I think if you want to do it more naturally, it also just lets you know how much more stuff you should do. If it's just kind of a little bit high, maybe you change their dog food a little bit. But if it's really high, you need to probably bring in a lot of things and do it longer.
Yeah. And to speak to that too, because I know a lot of the members here today are for like the holistic approach and wanting to avoid antibiotics and steroids and immunosuppressives. And as I always say, there's a time and a place for everything, right? And what's neat about this is I like that we can actually see that level of inflammation. So as you just beautifully stated, like, is it something where maybe if we are feeding a processed food diet like kibble, just transitioning over to a fresh food could make the whole difference. And if that's where you want to start, here's a test that you can actually do again after you've transitioned, you've got them on this diet, and then you could always repeat the test. If there's still inflammation, next level, let's use some herbs, let's use some nutraceuticals and other things that we can use to help clear out that inflammation, support the immune system. So there's so many different ways that we can use this, even from a holistic perspective, where we're healing the body and helping them with natural remedies. So perfect.
Yeah, I think it's great too. I mean, because it's not, it's not just people that they have, like they just have more research in people on the gut-brain connection, the gut, heart connection, gut, liver, gut, skin. They kind of have everything. It really is its own organ.
Yeah.
So.
Yeah, definitely. So tell us a little bit more about like the immune system side and how we can assess like how's immunity, because that's such a big part, right? That quote, like the 70% of the immune system is in the gut. So tell me a little bit more about that.
The other marker we have, in this test, this pair of testing, is secretory IgA. So it's a marker looking at like the first line of defense. It's right there on your mucosal linings. And it's on the surfaces. It's closely related to gut bacteria. And So it can bind to bacterial toxins, to pathogens. It can stop, kind of blunt down inflammation. It goes after foreign antigens. So when we're looking at that with secretory IgA, I think, that there's some interesting stuff that they have about it. And one of them was like, so we're looking at high. High kind of means that there's an alarm, like, IgA is, and it's either written as SIgA, IgA, secretory IgA, and they're antibodies produced by the, mucosal surfaces. And then about 75% of that IgA is bound to commensal bacteria, so good normal flora. So it helps modulate those things. But IgA we can see is really high. So if it's really high, it's identifying something's here and I'm working on it. So when I see high, I think, okay, something's there and they're working on it. I'm going to figure out what it is. But I'd rather see high, like I can take care of it. So sometimes you'll see low. Either they fought something so long that they just can't mount as good IgA response as they want. Or there are a lot of dogs that have like low IgA levels that, when we started doing all the breeding to kind of, when dogs stopped working, and I always want to get my dog a job because I think he would love it. Not Linda.
I was going to say, that's not Linda, right?
Linda's retired. She's almost 17 years old. But so when they, started breeding dogs for those kind of pet traits, and they ended up with more hip dysplasia. So you see that more. But one of the other things, they have an increased rate of selective IgA deficiency. So you don't have IgA, and people get it too, and people may not know they have it because IgM, IgG, other things will kind of help compensate. So you may not even know you have that as an issue until you really need it. So, dogs that might get more GI problems or have more respiratory infections, more allergies or autoimmune, it's possible they have impaired secretory IgA. So just kind of looking at that level to see, if they have, normal level, if it's really high or low, and how it relates to calprotectin.
Yeah. And so with that, because those levels we see them all the time, like quite low. And especially because we're dealing with a lot of chronic illnesses also. And so that makes sense, and why it's so hard for these pets to overcome a lot of these diseases, because their immune system's not working as well as it should, or it's exhausted. Now, in terms of pet parents who have been through like health issues, and say like they had a pet with cancer or chronic allergies or chronic GI symptoms, and they have this brand new puppy, would this be a test where it'd be a great, like, let's get a snapshot of what's going on in the gut to see maybe this puppy has a genetic predisposition to a low IgA? Would that be a useful way to use this test?
I would wait till they're about 4 months old.
Okay.
So right away, it's going to be pretty, it takes time to stabilize. Okay. So it matures as the puppy matures.
Yeah,
your
that makes
immunity
sense.
matures. Like in human babies, they have super high calprotectins, and they have a lot of opportunistic bacteria because there's more research on that. So it's kind of like they're there to fine tune the newborn immune system, and so there's a lot going on. So you look at those levels from a newborn, because it's going to make you think they have IBD, and they don't. It's just normal. It's really high.
Yeah.
So with especially with IgA, it's going to mature as the gut matures. So you don't want to go in and think, oh, there's something wrong. It just takes a little bit for the gut to mature.
That's good to know. I know there's a lot of proactive pet parents here who will jump all over this. So I don't want them to get like false results and then create, false worry and things that they don't need to worry about too. So if you find like IgA is low, tell me a little bit more. Can we bring that back up? Or is that something where like it's all doom and gloom, like good luck, this pet's going to have low immune system? Or how does that look with some of the research that?
No, I mean, I don't, it's never doom. I mean, it's never like.
I was being sarcastic.
Yeah, I know. I mean, it's also, looking at both these markers, like IgA, like I said, it's like 75% is bound to commensal bacteria. So it can also tell you the commensal bacteria is low. And anything you can do to increase commensal flora will help increase IgA. So
Yeah.
you want to look at it like that. And if it's, if it's really high, then you might want to just look for those things. There's a lot of associations with E. coli and maybe dysbiosis and an imbalance with that, or certain pathogens or food reactions.
Yeah.
So,
And I think that's a good point too. A lot of, pet parents are doing the animal biome tests or microbiome tests. And so that's different from what we're looking at here in terms of you're looking at with your microbiome, we're looking at the diversity, the different strains, all of that, whereas this is going to give us a better idea more so of like function, inflammation, a better idea of like how the things are working together. Would you say that's appropriate?
oh, yeah. I mean, they do well together. I mean, you can see
Mm.
things. So, all our tests are looking at, what's actually happening. So some of that you may want to know, like, oh, if this is really high, IgA is really high, but there's no real inflammation. But maybe I want to see what bacteria are there, what commensal bacteria are there. On the human side, we have tests that are, you have them all together. So you can kind of see, is the bacteria impaired enough that it's causing anything, or what can you do? So these are, we like these because they're actionable. Like you can deal with inflammation, with a test looking at leaky gut or impaired digestion. So, they're actionable, but I think that they, would pair nicely with looking at the microbiome.
Yeah. So what would be some good situations for using this individual test? Because you have comprehensive gut tests that do include the overall, like all of those that you
Mhm.
just mentioned, which are great. But if someone was to say, I need to pick like one of the smaller tests, where would this be a good example to use the calprotectin and the IgA
Yeah, I
specifically
mean,
for
to
them?
me, this is the first test I'd always go for.
Okay.
Just I think that other like leaky gut or impaired digestion can lead to this, but to me, it's like I want to know there's good immune function and no inflammation.
Okay.
So I
Yep.
think, I didn't do it on my dogs, although I work at a lab, so it's always hard to say the more information. But as a baseline to see, especially I like doing it on Linda because she is an older dog, and I want to
Yeah.
know if there's something I can kind of just catch earlier that I can kind of help support with her. But any kind of any GI issue, I would certainly go with this. If constipation, diarrhea, straining, um, skin conditions, all
Yeah.
those things. I think that to me it would be a first go to for really kind of most things, just
Yeah.
because the gut is so correlated to stuff.
Yeah, we see a lot of behavior issues too, and I think that gut brain axis also, this is where is the gut inflamed, and is it now causing inflammation in the brain that's leading to those behavior issues too? So, if we're just giving antidepressants and we're not actually treating the inflammation in the gut, this would be a great test to see. So we're not potentially treating the wrong thing or covering up those symptoms and ignoring this chronic inflammation that's occurring too. So, all those chronic diseases, allergies, GI upset, we see a lot of like acid reflux also. There's some other tests too that are really helpful for that, that I know you offer too. But, I love that we now have a starting place to look more at the function rather than going, invasive with we need biopsies and all of this to truly, and yes, there's a time and a place for those, don't get me wrong, but it's nice to be able to send in a stool sample, order the test from at like the comfort of your home too, without having to, necessarily go through a veterinarian. Of course, work with your veterinarian to identify what's happening and come up with a treatment plan. But I love that these tests have come out because on the human side, they've been so powerful in my own journey with my husband and his IBD. And so, it's refreshing to see that now our pets have some options. And so I think we've already touched on like why this is so important, but ignoring and not seeing inflammation and allowing it to continue is why we end up with autoimmune diseases and cancer and these frustrating health conditions that are really expensive and stressful to deal with. So, Dr. Betsy, what can like pet owners do with this information So you kind of briefly mentioned it. You said like if we have a high IgA and a low calprotectin, give me some examples specifically like that you're seeing with the tests that you're doing so far. And then we can talk about some of the things that, pet parents can do right away to start taking action and heal that.
Yeah, I mean, I think, calprotectin, I think, it's going to identify inflammation. It's also going to monitor effectiveness of treatment, so you can follow it. The other thing I think of, if there's a lot of inflammation, you're going to have decreased digestion and absorption.
Yep.
So fixing that's also going to help with it. Iron, zinc, fat, that's going to be pretty impacted. And then getting, if impaired digestion absorption, you end up with things in the colon that you probably don't want, like, distal intestines, that the bacteria there are, not necessarily going to have a whole bunch of protein at their access. But if there's a lot of inflammation, they may get more of that. And if it's not being digested. And so those make phenol compounds that can cause their own issues. Just like the inflammation and the neurotransmitters, with the brain. In people, if that inflammatory reaction pulls like tryptophan, which normally goes to make serotonin, that'll get pulled down an inflammatory pathway, and there's none left to make serotonin. You'll see those serotonin breakdown. So the inflammation itself, I think, there are a lot of conditions that I would look for. And then it also helps when people are going into, like, are they really in remission? So, I think I would look at those together. If IgA is good, I'm going to feel a little more optimistic, and calprotectin's high, I'm going to focus on anti-inflammatories and changing diet. And I have less concern that, diet's as big an impact, because IgA can go up as some food reactions. And they're less concerned that there's a parasite that I need to go find, or an imbalance in the gut bacteria, that it's the inflammation I need to deal with. So start looking at, and the first thing, even in research, is changing the diet. But that depends on what is your current diet.
Yep.
So, maybe you need to go all raw food. Maybe, or you can make your own food. Maybe you can just do a topper. But if it's really high, you may want to, be a little more aggressive and then work down from there.
Yeah. And I think too, there's a lot of talk about, diets and nutrition, and it can be quite a controversial topic, as we were talking about before. And this is where, though, this can be a really powerful test to showing us that if we do have that high level of inflammation, and we were feeding, a kibble diet that's cooked at high heat temperatures, has a lot of chemicals in it that are being produced by those high heat processing techniques, and then we switch them and we test, like, we're going to see, and you don't change anything else, like, that can also show us. But I also love what you said too, like, sometimes the diet change isn't enough or going to make that difference. And so being able to, and I see this too, where you change to a raw food diet and it didn't make a difference. So especially with like allergies, this happens all the time. Like, oh, I changed from kibble to raw. All these people had their allergies go away with their pets, and it did nothing. So maybe that's where like the IgA and the immunity, or the immune system's off. And that's actually the problem. It's not the level of inflammation that's in the gut. So
yeah, and you might have to try a little harder on this particular food or this compound.
Yeah. Or
And
using like herbs and things like that to help regulate, and making sure like the prebiotics, and if there's, issues there too, making sure we're feeding the good bacteria and supporting, short chain fatty acid production and all of that also. Those are important things too.
Yeah, antioxidants are good. I mean, in IgA, Saccharomyces boulardii, that's, good research. That's in people and humans. So, and then I think that like the standard process chlorophyll.
Yes,
Mentioned in one of your very nice videos.
Yes, the chlorophyll complex is amazing. There's so many, and that, once again, that's like a whole food supplement. So rather than extracting out, isolates of these vitamins and minerals or nutrients, using whole foods to feed the good stuff, but also use that to reduce inflammation and support the gut lining and the microbiome itself. So yeah, there's so many different ways to approach it. And the Saccharomyces boulardii is a common one we use, and it's a great starting place for supporting the immune system and its immunomodulatory properties and helping the microbiome. So in terms of, I would love for, like, before we take some questions, I would love a couple different main takeaways that you have, Dr. Betsy, that you'd want to leave with pet parents, whatever you feel compelled to share that you think will be the best way to like use these tests, or how can best help them to get people started with it.
I would start with if you don't know where to start with the inflammation and immunity. And you can see, like, it may be that they're both fine. Your dog's doing well. And then what the lifestyle, like, the recommendation on that is just keep doing what you're doing.
Yep.
So that's kind of always good to know, like, this is working out. So, what the whatever system you have set up. But then if one of those are elevated, you can address it. They're not, it's not just me and, alternative type of medicine or veterinary stuff saying that. There's a lot of good research. I have all these, studies that I'm always looking at. But, they even talk about, like, kibble, and then kibble that's fed, that's excessively, like, dried or cooked, and the impact. So, the whole research knows that it's going to have more inflammatory response. It makes those AGEs that cause things. So I just think it may seem overwhelming. That's like maybe starting with two, like just two tests, like the IgA, the calprotectant is an easy way to build from there. And then if you don't get response, you can do some other ones. But there are good recommendations on there. I think if there's an elevation, then, and your diet is just currently kibble, then start to look at, making your own food. Move from there. So I see the same thing in people. So, I mean, that's how we transition to our pets, is because we had pets with problems, and we're like, wait a second, they're not a different, they're not aliens, they're mammals, just like us. They have, a stomach and intestines and a gallbladder and, a liver. So it's not like they're so foreign. So a lot of the things that work for people can work for pets. So.
Yeah. And I love that. I think that's really, really important. And I always say this too, because we've gotten kind of away. I mean, there's more of a shift now, which is great, but we've gotten so ingrained with that, like, we have to feed our pets processed food, because if we get away from it, we'll unbalance their diets and create harm. And there's no way we would follow that or we shouldn't be following that for ourselves. I know everyone's diets are different, but we know that processed food for humans all the time is really bad. And so we have to have that mind shift and shift our belief system a little bit, and look at also all the research that's out there to actually show us. And like, what's neat now is being able to introduce a lot of these testings, so we can even get more research to show this. So one question that I do have that probably a lot of people will be wondering is, so say they do this test and it comes back a little bit abnormal. How often would you recommend retesting with this?
We generally say if, 3 to 6 months.
Okay.
So, then you can see changes. I wouldn't, if you do it too soon, you're not going to see changes and stuff. So I think that, 3 to 6 months is about when you would start to see the impact of what you're doing.
Yeah. Awesome. So for everyone here live on the call, if you have a question, drop it in the Q&A box. We have a few minutes to answer a couple questions, because I know this is kind of like a newer idea area for a lot of people. So drop those questions. I see them. Let me bring this box up so I can ask Dr. Betsy. Let's see. Okay, so, and I don't know if you'll be able to, if you're familiar with Dr. Jean Dodd's food sensitivity test, the NutriScan, I'll be able to, so Andrew, are you familiar with that one?
I'm not familiar. I'm thinking, is that IgG or is that?
Yeah, it's not measuring IgE. So it's looking more at food sensitivities versus allergies. So Angelo is asking, what's the difference between your test and the food sensitivity test? So probably wondering like the difference between IgA versus some of these, IgE, some of these other like immunoglobulins.
Right. IgE is going to be, classic allergic. IgG tends to be more of a, and I haven't seen the test, but just in general, IgG tends to be looking at like a longer term food reaction. It's been a blocking agent for IgE in some respects. So, we generally think of that. And IgG total has a half-life of 21 days. So usually it's like if you exclude it for 21 days in people, and I'm not sure in pets, that you can start to see that those come down. So those are more in a blood reaction. IgA is happening right at the mucosal lining. So it's right there. It's the first line of defense. I always think of it as like the bouncer, like, can you come in here?
I like that.
Let me see who you are, and trying to decide like who can come in and how many, more how many bouncers do they need to get out there to like take care of something. But I think that it would really just tell you what's going on at that immune lining at the mucosal surfaces, and IgG is going to be, more systemic.
Yep. That's exactly how I would explain those differences. So with food sensitivity testing, once again, there's pros and cons to everything. And a lot of times, if you're worried about that, one of the things we recommend is doing a food elimination trial. That can be one of the easiest. It's also cheaper, where you're eliminating the foods that your pet's been on before, and you're using novel proteins that they've never been exposed to, and keeping the diet very simple. That typically has to be like 6 to 8 weeks, but that is definitely something you can do. But as we've been talking about with this immunity inflammation panel by Innovative Pet Lab, there's a link also on the Facebook page that will also go out to everyone here, where you can see and take a look and see if you want to order this test with a discount code too. But knowing like, is there inflammation in the gut lining is really important for that also. And then also that IgA that Dr. Betsy just talked about, like, are we allowing things in that shouldn't be coming in too? Or how well is that immune system working? So that was a great question. Now, let's see.
Okay, I got my first one down.
Yes. We
also see it, that if you have a lot of IgGs, it's oftentimes associated with leaky gut, so
yep.
Get it that one.
That's great to know. I know a lot of times the blood test with food allergies in pets isn't super sensitive. It's and so you can get mixed results. That's why I always say like doing a food trial is going to be the most helpful. It just can be more time consuming. So, we like fast results, but I always recommend that. This is a great question from Catherine. Does this test work for cats?
It should. We are validating cats right now. So it's just real easy to get dog poop.
We sent in our cat stuff, which was really neat to see.
Okay, good. Yeah. So we just have to get, enough cats. And then we were doing some studies, just like, does it make any difference, if you have cat litter on it, and, those kind of things. So
yeah,
you can go to a dog park, with a cup of coffee and offer to buy people a cup of coffee if they can have their dog poop. That's been done.
And cats are a little harder, so yeah.
But we are working on it and looking at the research. Yes.
Okay, perfect. Because I know we've got a lot of cat people. There's a lot of cat questions in terms of, does this test work for cats? So, and I can tell you, like, from what we've seen with our test results too, it correlated with how strong, like, there's no symptoms, no GI symptoms, there's no allergies. So that was really nice to see. Obviously, take it with a grain of salt because you're finalizing everything, and it was really easy to do. That's what was really nice about the test and the whole process. And then also the reports in the back end. I really thought that process was really easy to follow, do, understand, and your customer support's awesome, which I really appreciate too. In terms of the testing, right now it's only available in the US, is that correct?
That's correct.
Okay.
So
I mean, it's stool, so it's hard to get samples sent in and all of that also with customs and things like that. So, and yeah, so right now only the US, but it doesn't mean that you can't do stuff to help support your pet's gut health. So just because if you can't
Right,
access
and we
this
would,
test,
yeah, we certainly want to be able to at least, get to Canada.
okay, perfect. So Canada's coming. All right.
So hopefully, yeah, I don't, yeah, we're looking at what all it entails. It's really just, arranging the US mail.
Okay.
Yeah, I'm half Canadian. My
Okay, we
mother's
got to get it up there then, right?
Yeah.
We do have a lot of Canadians here. So we do have a big Canadian population in our community. So I know a lot of people will be really happy to hear that. In terms of, so where can they get these tests? Once again, this is Innovative Pet Lab. So innovativepetlab.com. And you can use code NaturalPet25 to get 25% off of those tests. You can order it straight from the comfort of your home if you're in the US. And there's great instructions on how to send a stool sample back, and then you'll get a report. How long does those results usually take to receive?
Well, our turnaround time is 2 weeks.
Okay.
So it should be, no longer than two weeks. So we just, we run the test every 2 weeks as they come in.
Okay, perfect.
And,
Yes.
if you're in Canada and you want to run it, you can reach out to us and we can, see what the demand is and how quickly we need to.
Perfect.
That.
Awesome. And I'm getting some questions, quite a few questions on, would the test be beneficial for dogs with acid reflux? And then another one, same test for chronic inflammation as well as for acid reflux. So,
I mean, I think that it's going to be different as far as, acid reflux could have an impact because it's all connected. I don't know. I haven't specifically looked at, which would, of course, really be interesting to me, like dogs with and without acid reflux. But yeah, I mean, it's going to work for anybody because it's just identifying the level of inflammation and immunity. So it's just telling you what it is. So you kind of have to just try to bring it down. It's possible, and I'm just guessing this, like if you tried to bring it down, it didn't come down, maybe that would be one of the areas you would look at. So, but I haven't seen a correlation. Certainly with people, it doesn't tend to be a big correlation with the calprotectant, except if it's partly due to if somebody has like, H. pylori, that can affect everything kind of downstream, and that can change the microbiome in the gut, which then can lead to more inflammation.
Yep. I think too, with a lot of acid reflux, this is a big one for diet, but also too supporting, the proper levels of stomach acid and digestive enzymes too. I find that a lot. Chlorophyll complex, what we were just mentioning too, is also a really good option to help like soothe and calm. But this is where using things like slippery elm or marshmallow root are a really great soothing mucilage that can also help coat inflammation. So while you're trying to figure out like, why is this happening, and you're making some adjustments, those are some great like supplements to help get your pets started on to help with that symptom, help ease those symptoms, because acid reflux, as we know personally, if you've ever had it, does not feel good. And so it's really hard to watch our dogs, go through that and feel that. Okay, let's see. Lots of questions that we've answered, which is great. Please come to Europe. So
We'd love to. Something else I think that can impact inflammation, which I was surprised to even find it in the research, was just being outside in nature. There was a study like just go out, get your dog outside. If your dog's inside that all the time, or you're letting your cat out, or just, I think that those kind of things, can have an impact. I mean, I know like that seeing the research even for people on grounding, like they did a study and they were college athletes, and some of them slept outside on the ground and some of them just slept in their college dorm, and they did it for a week. And the people who slept on the ground outside had lower inflammatory markers.
Yep.
So.
I love that. We talk a lot about emotional health as one of like the foundations of health, like one of the pillars. And this is that direct connection too. I imagine there's that gut brain axis, the hormones that you're producing too, that feel good, that gut feeling, right? When we're outside in the forest, who would rather be in a huge city surrounded by people, traffic noises and pollution, or would you rather be surrounded by nature and quiet solitude? And I mean, that could be different for every person, but I would much prefer being surrounded by nature, and you feel different energetically, and that impacts your cellular health too, which is so amazing. So it's neat that you can actually see that. It's always fun because you're like, well, it's the gut feeling, right? And you're like, no, we can actually measure it. There's less inflammation there. So I love that you brought that up, because animals need to get outside. They need exercise. It's going to impact their gut health. It's going to impact the level of inflammation. It's going to impact your relationship with them and how you feel personally too. And so many people have the same health conditions as their pet. So because we're so closely interconnected. So definitely take care of yourself by doing, some of these simple things to improve your health and your pet's health also. But so one final question I have, and I don't know if if you know this answer or not, because there may not be studies for it, but my dog has severe seborrhea. So this is like an autoimmune skin disease where they flake off their skin. And it's usually for life, and using medicated shampoos is one of the ways to help treat it. Would this test be helpful for her?
Well, you're right. I haven't looked at the research for that. I know low levels of secretory IgA can be associated with, atopic dermatitis. But I would say that even if there's not like research that connects it, if your dog also has increased inflammation, then that's going to probably just make it harder to treat overall. It's always a good idea to just bring down inflammation that you see.
Yeah. So I think like test is not going to do any harm. It can give you more information, potentially if there's something aggravating that's contributing to having it being harder to treat. Or, I know with a lot of these patients too, they'll have like flare-ups, whether it's seasonal allergies coming in also. So I think it's good to make sure we're not missing something. And I think some of these tests that we're talking about and we'll be talking about in the future are great options that you could always start with to make sure things are good. And we're not just assuming and, hoping that things continue fine. And when especially now we can test and then get a handle on things and take control and make sure that we're doing as much as possible. So I love all of this. I could talk to you forever. I know you have so many amazing research studies too. So I'd love for you to share some of those with me afterwards so I can share these with the community so that they can dive in and see that there is a ton of research. So because that's commonly one of the things that I hear, there's not enough research out there for our pets. So I know you've got like a stack full of stuff.
Oh yeah, this one I really liked. It's biomarkers of gastrointestinal functionality and animal nutrition and health.
Yes, I love it. We'll share that one.
Yeah, I'll send it. Yeah, I'll send you the PDF. It just looks at like diet, digestion, inflammation, all these different neuroendocrine. Yeah. So
perfect. So
it's a page turner.
I love it. So for everyone here, I appreciate all of you taking time out of your day, whatever time of day it is, wherever you're joining from in the world. I know we have people here from all over the world, which is really exciting. And once again, you can get these tests, these stool tests from Innovative Pet Lab, simple, innovativepetlab.com. And you can use code naturalpet25. I'll be sharing this all in an email and with the replay so you can re-listen to all the amazing information and knowledge that Dr. Betsy shared with us today. I'd love to hear just some final words from you, Dr. Betsy.
Well, thanks for having me. I mean, so we're trying to make tests that we think are going to help, pet owners in every day taking care of their pets. I mean, we worked in functional medicine for years, and then we were like, hey, I'd like to apply this to my pet. I don't want to do all these other things. I don't want to start them on meds. Can I just see where they are in this state? And so we're like, hey, we can. So,
I love that. Yeah, it's great. This is exactly what we've needed. And so I'm so excited that you and your company have decided to do just that. For anyone here who is needing more guidance and help and support with their pet's gut health, we are also doing interviews for our upcoming 6-week gut health intensive program that includes some personalized testing that can be done alongside these Innovative Pet Lab tests, and then also guidance, support and educational program to help you get the results that you're looking for. So if you need some help with that, definitely check out the link in the Facebook area. I'll be sharing that with you too, because we're just taking a small group of pet parents to go through that program and get you the results and transformation that you're looking for. I'll also be sharing some of our favorite supplements for healing the gut, and a link to that. So you can take a look at some of the brands that we trust, love, and like and use for our clients to help heal the chronic inflammation, support the immune system, and help you get the results you need to. So thank you again for everyone showing up, taking time out of your day to be the most amazing pet parents that you are. And we'll keep you posted on any future lives that we do to share more about this incredible company, Innovative Pet Lab, and all the amazing things that Dr. Betsy and the rest of her team are doing. All right, everyone, I'm Dr. Katie Woodley, the natural pet doctor. Have a great rest of your day. Thanks again, Betsy.
Thank you.